All right. So, do you want to just start by telling me a little bit about yourself?
Sure. I am currently in my last quarter of nursing school. I'm in an accelerated BSN program, and I'm just super excited to nursing from my unique experience being a PCT during the pandemic. I've learned from being a PCT that this is my way of being able to just give the best parts of myself to my patients, and that's the kind of nurse that I strive to be in the future.
Okay. Great. I like it. I almost wish you would like say a little bit more about kind of like if someone was going to ask you like, well, why didn't you become like a doctor or like a social worker? Like why nursing? Is there any kind of
Okay.
like back history there that you could share?
Yeah, so I think for me, like coming out of undergrad, because this is my second degree, I realized I wasn't sure what I really wanted to do. I was always interested in how the body worked and I loved helping people. So I knew I wanted to do something healthcare related, but I wasn't sure what that was until I actually got my first job, like working in a hospital. And I realized that there's no other profession like nursing and healthcare that involves holistic care, like not even just taking care of your patient's physical needs, but also caring for their emotional needs. And I think that's what makes nursing very unique and why it's the kind of field that I want to go into. Yeah, so I want to work because I believe that I strongly align with your mission and values. Hopkins' mission is to improve the health of the community, and that's exactly what I want to do as a nurse and why I want to be a nurse. I was born and raised, so I want to have the tools to be successful as a nurse and be able to serve my community.
Um, Maybe you could add a little bit more about like you could look on their website for their mission statement. Like, do they talk about like advancing the nursing profession through education or like what's like add like one specific thing where you're like, yes, that's me, that's what I want, and then like talk about how it's important to you. Just because
Okay.
like your answer is so short, it's kind of like, oh, okay,
Yeah.
next, you know,
Right.
just to give them like a
Yeah.
little bit
Yeah.
more.
I could
Yeah.
also say like, because I was a PCT on the floor, and one of the nurses that I worked with, who was one of my favorite nurses, she had told me that she actually came out of their new grad residency program.
Oh,
So yeah, so that she definitely pushed me to apply for this.
you could say that. You could say that, yeah, basically what you just said, that like you've heard such great things and
Mhm.
your coworkers have recommended the new grad program because they've loved it so much. Yeah. And then it kind of shows like you do know what you're signing up for, you know?
Yeah.
Can you please share with us one strength and one weakness?
Yeah. So I would say that my biggest strength is that I'm very curious. I never just go through the motions of things. I always need to know the why behind what I'm doing. And I think that's really important, especially in an ICU setting where we're always using our critical thinking skills to not wait for something to happen, but to try to anticipate what's going to happen, to stay one step ahead of our patients. I think that's really important. And I'm not afraid to ask questions. If I'm not sure of something, I'm going to ask my nursing colleagues, someone with more experience, to make sure that I'm not putting my patient in danger. And then a weakness of mine, I would say that would be that sometimes I do get overzealous and undertake a lot of things, especially coming from a tech background before nursing school. I came into nursing school having to delegate tasks that I was used to performing before school. So I had to learn through my clinical rotations how to delegate those tasks, but also have that balance of checking in with my ancillary staff to make sure that they're not being too overworked, because I know what it's like to be on the other side of that.
Okay. I think those are really good. I like that. Can you
Okay.
please tell us about a mistake that you have made in your clinical experience?
Okay. So a mistake that I made was when I was floor as a PCT, and I was the only tech that day because we did have a call out. So when I was getting handoff shift report from the night shift tech, she had told me that she checked the supply room, made sure that the gyroscope was stocked with two stylets, and that the AED machine was working. So I took her word for it. And my priority that morning was to make sure that my nurses were good, help them turn their patients, check any blood sugars, help walk, the cardiac patients on the floor. And of course, there was a code on the floor that day. And one of the nurses went to grab the gyroscope machine out of the supply room, and there was only one stylet on the gyroscope. Luckily, the intensivist was able to successfully intubate the patient, but I realized that day that I cannot take someone else's word for something. I need to always make sure that I'm verifying any orders, or making sure that my patient is good instead of taking someone else's word, because that's a very dangerous situation.
I think that's a really good answer. I love the part also where you're talking about the different things you've done in the ICU that you're like already comfortable with.
Okay.
Yeah, no concerns with that. I think that's great. Can you please tell us about a time when you collaborated with others?
Yeah, so during one of my clinical rotations, and I had an older patient on the floor for shortness of breath and fever. He was later diagnosed with pneumonia. So this patient was getting ready to be discharged, but I heard him report that they needed to do a 6-minute walk test before he was able to go home, because they wanted to see if he needed to be on any oxygen support when he was home. So I heard that in report, and while I was in my patient's room, I was doing my assessment on him, the physical therapist came in saying that she wanted to work with the patient. And I had told her, what I heard in report, that respiratory therapist also wanted to do a 6-minute walk test with him. And I brought up the idea of all of us collaborating to walk this patient and, just help each other out, because I was looking under his progress notes also. And the physical therapist was saying that, he had a lot of trouble the day before, especially because he was experienced dyspnea on exertion. So I wanted to make it easier on the patient, and we were all able to collaborate. And I was kind of a liaison between the respiratory therapist and the physical therapist, but we got our patient up. He was able to actually successfully walk down the hallway, which was great to see. And he didn't need to go home on any oxygen support, which was great.
Okay. No concerns with that one either. You're doing really well. We have a lot of great candidates. Can you please tell us why we should pick you?
Hmm. So I think what I can bring to your team is that, I have healthcare experience, especially being in a time as crazy and as unpredictable as COVID. I've learned how to be adaptable, and, how to learn how to interact with my patients before going into nursing school. And I've been able to expand upon those skills. I'm also a great communicator, whether that's communicating with my nursing colleagues or my charge nurse or my patients. My managers previously told me that the nurses love working with me because I'm always a strong team player. They never have to ask me for help. I'm always volunteering to help anyone on the floor, whether or not they're my patient.
Can you please tell me about a time when you had a miscommunication in clinicals?
Ooh, that's a really good question.
Right?
Think about that.
I think what they said was, can you tell us about a time when you communicated something and it was not received correctly or as intended? So,
Mm,
any of that.
okay.
I was thinking about this and I thought like maybe the best one would be like something where you almost made a mistake. Like the one where you had the miscommunication about the glide scope.
Oh, yeah.
Use that. But
Mm-hmm.
then what would you use for the mistake one? But something like that where it's like you're glad you double checked something or like
Mm-hmm.
something like that.
Miscommunication. Sorry, I'm just trying to think.
Like the one that I was thinking if I was a new grad, what I would have used is I had some story about how like there was all the supplies for the feeding tube and there was a
Mm,
bottle of like rubbing alcohol like where they usually put the sterile water. And
mm-hmm.
so I like moved it because I thought, oh gosh, it'd be like really easy for someone to accidentally use that instead. Like things like something like that, maybe. You can think about it and like come back to it.
Okay. I was going to say maybe miscommunication. Like, mm, Yeah, I think I'm going to have to think about that as
That's
we're
okay.
going through these questions. I can't think of
Um,
something.
just in case there is something where they throw you a curveball in the interview,
Mm-hmm.
you can say something like, oh, that's a really good question. um I haven't had a scenario like that, but if I did, this is what would be the most important to me. And then you just talk about like how important it is to have good communication and like,
Mm-hmm.
so you can still answer it even if you can't think of an example for whatever they give you if they do throw you some kind of curveball.
Okay.
Yeah.
All right. Thank
Um
you.
yeah. Can you please tell me what your hobbies are outside of nursing and what your self-care practice looks like?
Okay. So I am a huge advocate for self-care. I've been incorporating it more recently in my life because I've realized that, I can't expect to be able to take care of someone else if I can't take care of myself. So some things that I like to do outside of work involve, working out. I've gotten really into Pilates classes, which are super hard. I always leave every class feeling sore in every muscle group of my body, but it's a great workout. And I also love to cook. I've been cooking more recently with my roommate. She's Indian, so we will cook like Korean and Indian dishes together. I'm a big foodie. I love to go out and try new foods. And yeah.
Okay, cool. When you say that, I'm like, all right, she seems like really mature and maybe she's going to bring food to the break room.
Yeah. For that question, I would say I was working with this male nurse whose patient was Muslim. And I can't remember what brought her into the hospital, but she needed to get a not a Foley, an intermittent catheter done. And I knew that, her culture, there's a big emphasis on just staying modest. Like modesty is a big thing in their religion and in their culture. So I was trained on how to, do Foley catheters. I offered my nurse to to do the straight cath for that patient, so that she wouldn't feel uncomfortable, and like especially because he was a male. So where I see myself in 1 year, I see myself in this organization and just undertaking more leadership roles. I would love to one day be a preceptor to new graduate nurses like me, and also possibly becoming a charge nurse. And then my long-term goal, so where I see myself in 5 years, is I really want to get my CCRN certification, and just be a mentor to nurses who, and just try to help shape the trajectory of future nurses.
Cool. Um, do you guys do any like certifications for continuous dialysis or like ECMO or anything like that?
I think not in school. Like you mean like
Oh, no, no,
once
no.
I'm
I mean like for the 5 years. Like, is that a thing you
Oh,
mentioned? Does that make
so I
sense?
yeah, so I know that they do ECMO on this unit, but I'm not sure what the certifications are for that. So I'll have to look into it and see like how I
Yeah.
could be certified. Because
Like
that, I mean, that's something that I would love to learn how to do.
you could say just like as a general thing that you would love um to acquire any additional skills that might be available, like ECMO or continuous dialysis. Um,
Hmm.
and then I don't know if there's any other examples that make more sense for your hospital, but those are like the typical ones that people say.
Yeah. Okay.
And
Thank
then
you.
people
That's a
also
really good
talk about
point.
like committees.
Okay.
Yeah. Can you please tell us about a time when you had to um, make a change in a patient's plan of care?
Hmm. So I had this one, I don't know if this fits, but I had this one patient. So I was in her room and I was helping to clean up the patient. And as I was cleaning her up, I noticed that she had some like blood clots in her bowel movement. And I asked the patient, if she had any abdominal pain, and she told me that she was feeling some pain. And she, expressed her concerns to me because she told me that she was going to be discharged, that the doctor had just come in to evaluate her, and that they were going to send her home. And, she was really concerned and very anxious. And so, I told her, I tried to listen to her, be an active listener, because I could tell that she was really fearful. And I told her I'm going to talk to the nurse and like see if that, I can do in my power. So I left her room and I went out to the nurse's station and I found the nurse and I told her my concerns. I told her that I saw the blood clot, and the nurse tried to reason with me by saying that like her H&H was normal, that the PA had already gone in to assess her that morning. So I told her, I said, the next time we go in, or I asked her if can we go together so that, you could assess her, the the nurse came into the room with me. When she saw that, she immediately messaged the doctor, and she was not discharged that day. She got to stay another night.
Cool. I really like this story. I feel like you could use it for a couple different things. You could use it for like if they ask you, tell us about a time when you advocated for a patient, or tell us about a time when you had a disagreement with an instructor. If you do it for so anything where it says like disagreement with an instructor, or like a time that you had to get feedback from an instructor or got constructive criticism, make sure those ones, they're usually like, so how it works is usually they give a rubric and then you're scored from like 1 to 5 on whatever it was like you're supposed to be demonstrating. And usually for those questions, the thing that they're supposed to be scoring you on is your ability to like take ownership for mistakes and like take feedback well and make changes. So for example, with like the mistakes question, a lot of people are like, here's a story where my instructor said I made a mistake, but then I showed her the policy and actually I didn't make a mistake. And it's like, cool, I'm glad you didn't make a mistake, but like, I don't know how to score you for like taking ownership and making changes. You know what I mean? So for those, if you don't say a time when you like actually legit made a mistake that you had to take ownership for, you always want to say like,
cut off again, Mary.
Is this better?
Yeah, I can hear you now.
If you're for those type of questions, if you're not saying like an actual mistake that you took ownership for, you want to make sure you at least voice that like it's important to you to like, that you really value when someone with experience like shares their experience with you, and that good nurses make mistakes, and like those are the learning experiences that are really valuable and people share them with you, or just something that like makes it sound like you take direction really well.
Okay.
Okay.
I had a patient who came in so during change of shift, I went into his room to go check on him because I was going to be his tech again. And he had an NG tube in, and I noticed that there was blood coming out of his NG tube. So I tried to arouse the patient. He was unarousable, checked for a pulse, did have a pulse. So I immediately called the nurse, told her that there was blood coming out of his NG tube, that it looked like coffee grain color. And then I also called the charge nurse because I knew that this was a serious situation. So while the nurse was coming into the room, I immediately checked his vitals. His blood pressure was low. It was like 80/50. We called a rapid response on the patient, and I stayed in the room the whole time. It was kind of like a runner to go get things out of the supply room. And we were able to stabilize the patient, and he was transferred. And the nurse thanked me after, and she said that she would not have been able to handle the situation without me.
Oh. Did you guys give the patient like blood or fluids or anything? Or
yeah, they gave him fluid and they gave him blood.
You could say that too.
Okay.
First.
Okay. Yeah, they gave him fluids. I think they gave him like.
So yeah, say that like they gave him blood and you guys gave him blood and you guys gave him fluid. That's a really good story. Make sure somehow you work that in. So like, a time you advocated for a patient, a time that you had a patient where you had to act quickly, like anything you think it fits for, I would tell that early in the interview.
Okay.
Because it shows that you're ready. Like most new grads, like they freeze and they don't even like think about like, do they have a pulse? They're just like, oh no, this is bad.
Yeah.
So like,
oh my
gosh, it's unusual that you like were with it enough to do that even when you were like really freaked out. So definitely tell that story.
Okay, cool.
Yeah. Can you please tell us about a time that you had a difficult patient?
Yes. So whenever I have a difficult patient, I always just try to remember that they may be hostile or upset because they're in pain, they're away from their families, or they're just in an unfamiliar setting like the hospital. So I did have to a hospital because he fell and he broke both of his legs, and
Oh
he had
gosh.
dementia. At the time, families weren't allowed to be at the bedside. So when me and the nurse were in the room trying to clean the patient up, he became very agitated. He tried to spit at us and, call us names. So I knew that we weren't going to be able to change him at that moment. So I suggested to the nurse that we try to call his family and get his family on FaceTime. I knew he had a daughter, and I figured we should just try and see if she could talk to him and help him calm down. So we got his daughter on FaceTime, and I told her what we were trying to do, and she talked to him, reassured him that we weren't there to hurt him or anything. We were just trying to help, and we were able to successfully do our job.
Awesome. There, tell us about a time where you received negative feedback or constructive criticism from an instructor.
So this wasn't from a nursing instructor, but I did receive feedback from one of my managers when I had first started as a PCT. She told me, that I was a great, team player, and that, she was really happy that I was on the team. But she said I'm undertaking a lot of things. She was a tech before she was a nurse, so she kind of knew what that was like. So to make sure that I wasn't overworking myself, and that I wasn't taking on too much to the point where it was wearing. So I really took her advice and kind of kept that in the back of my mind. So I took that and I applied it by learning how to ask for help, learning how to prioritize better. And I know that whatever role I'm in after nursing school, I'm going to make sure that I'm reaching out to my charge nurse or my supervisor to make sure that I'm not taking on more than I should.
I was expecting you to say like you've gotten more comfortable with delegating to the patient care techs. When you say like reaching out to your supervisor, I'm like, wait, so is she going to her manager's office and like asking them to clean a bowel movement, or like what is she? I'm very confused. What is she telling me? Like I can't really picture.
Yeah. I guess I was trying to say like that in the future, maybe not my supervisor, but like any nursing colleagues that I have who have more
Yeah.
experience, like getting more advice from them and making sure that,
Oh.
I'm not wearing myself thin, basically is what I was trying to say. Like
Oh.
I basically want to seem like I'm continuously working on this, like I'm
Yeah.
always trying to improve on this weakness of mine and get
I
feedback
see.
from people.
Yeah, I would say that because I think like what they're going to be expecting you to say is that you delegate, and if you say that you go talk to the people above you, they're going to be like, wait, for what though?
Mm, clinical scenario questions, yeah, that would be great. Because
Okay.
I don't know what they could ask with that.
What would you do if you came into your
Okay.
patient's room and you saw your patient is on the commode and they look like they're kind of slumped over and look like they may have passed out? They might be like unconscious. You're not really sure
Yeah,
as
I can
you're
hear
walking in.
Okay. So if I came into my patient's room and I noticed that they were unconscious or not totally with it on the commode, the first thing I want to do is I'm going to go to my patient, try to arouse him, see if they are arousable, meet their oxygen needs, if they need to be on like a nasal cannula or a non-rebreather. I'm going to check a pulse, make sure that my patient has a pulse. I'm going to get the vital sign machines, check their pulse ox, check their blood pressure, make sure that Also make sure that I'm using the staff assist button or calling my charge nurse to get a second hand in the room and ask them to grab a glucometer so that we can check my patient's blood sugar to see if it could have been a hypoglycemic event. And then if my patient is arousable, I'm going to further assess and see if my patient can recall what happened during the situation. If he's not, then I'm going to continue assessing him, doing a neuro assessment, checking, his pupillary reaction. What else? Pause. And then once I also want to make sure I'm assessing my patient for any injuries, checking for bleeding. And yeah, I think, and then before I, once I know that my patient is safe, then I would get the assistance of my staff or my charge nurse to safely transfer my patient back to the bed so that we can continue doing our interventions on my patient.
Okay. I think that's good. I also mention looping in the doctor, letting them know what happened. And then if they're not arousable, that you would call the doctor, and you would also loop in rapid response, assuming that they had like vital signs and they were.
Okay.
And then.
Right. But if they don't, code.
Yeah. And like, it could also be like a stroke thing too. Like sometimes if they're like, unarousable, it's like that's the start of like the code stroke. So you could mention ruling out stroke through a neuro assessment.
Okay. So for that, would I be assessing for like arm weakness, like facial?
Yeah. So like, are they ANO times 4? Can they talk to you? Do like the pronator drift thing. Have them smile.
Okay.
See if their strength has changed in any of their extremities.
Yeah, I was gonna ask if you have any like cardiac related issues or like I know that they also love to ask like prioritization questions like here are 4 patients, who would you go see first and why? What are you going to do for that patient? I know that they love to ask those types of questions as well.
Interesting. I'll give you 3 patients. So the first one is a fall risk. And says that they need to go to the bathroom right now. And then that's what your tech has come up to you to say. Your second patient has gone on the call light and is talking, but is not making any sense at all, which is new for this patient. And then your third patient is complaining of the same chest pain that they have had during their whole admission.
Okay. So these are really good scenarios. I would say that for the fall risk, a big thing is safety. I want to make sure my patient is safe, but that's something that my CNA could do. So I'm going to delegate that to my CNA to see if she can go into the room, help the patient as long as he's a 1-person assist, and she's able to safely get him to the bathroom. I would go and see my patient who I can't understand on the call button because that is a new onset of a symptom. In my head, I'm thinking, is it a possible stroke? Is he having a neuro event? So I would go in and check on that patient. I also don't want to be leaving my cardiac patient. So I'd see if I have another like nursing colleague or a charge nurse that could just go in to check on my patient who is experiencing chest pain. And then I would go into my patient's room who I couldn't understand on the call button and do a neuro assessment on him, try to get more information, page in the doctor to let him know that my patient's experiencing this, like slurred speech or garbled speech, whatever it is. And Then after I know that after I've done my assessment on this patient, then I'll go into my other patient's room, my cardiac patient, make sure that he's got a pulse, ask more about the chest pain, where it is, check the monitor, the telemonitor to see if there are any like dysrhythmias that are showing up on the monitor, and then see if there's anything that I can do or any meds that he's got for his chest pain, such as like nitro or like a vasodilator.
Okay, perfect. And if it was new chest pain, you'd want to get an EKG, but like if it's one that he has had, then the doctor's going to say no need.
I guess one thing I could have said is maybe any like lab work that my patients may need that I'd make sure that they're ordered. Also checking like any sugars, and else. Yeah, I think that's something else that I could also throw in, or any like diagnostic studies that I know my patient would need to get done. Like maybe going, my patient getting ready, that patient, like a CT scan, the one that I couldn't has this like new onset.
You could talk about making sure they have good IV access while you're waiting for rapid to arrive.
Okay.
Yeah.
That's a good point. Thank you.
Yeah. You're making this too easy for me.
I'm glad. I hope that it goes this smoothly on the actual interview.
Like trying to throw you off. What would you do if your shift replacement did not arrive on time or at all?
So I have had this happen to me before where my shift replacement was late. And, I'm not the type of person to just abandon my patients. I always want to make sure that I'm putting my patients first, even if I am tired after a 12-hour shift. I had this one shift where I was a sitter for a patient, and the sitter that was supposed to take over my shift was running late. I knew the person that was taking over my shift, so I reached out to her to make sure that she was okay and just to let her know, that I was going to stay until she got here so that she wouldn't feel as stressed or just feel like really stressed about having to come into work late. And she came in maybe like an hour after change of shift, but she was super appreciative. I tried to make sure that her patient was washed up before she got there, and just did everything that I could, making sure that my patient was in a good place before I left my shift that day.
Oh, that's amazing. So like, I feel like the standard is to just express that like you just want your colleague to get there safely, and that you would like reach out to your charge to see like if it's most appropriate for you to stay, or if they would prefer that you give them report. But I've never heard anyone talk about how you would like make sure that person has a good start to their shift, like kind of knowing that they're going to feel behind. Like that's actually really considerate. I love that. Have you ever been told to sacrifice quality care for efficient care by a supervisor? And if so, what was the outcome?
Okay. So I did have a situation. I had one shift where I was precepting this nursing student who was coming on to be a tech on our floor. And after we did all of our morning vitals, made sure that all of our patients are washed in the morning, and we had all of our duties done. One of the nurses needed a Foley catheter insertion for her patient, so she asked me and the girl that I was precepting if we wanted to do that on her patient. And I use this as a teaching lesson, because the girl that I was precepting, she had never put in a Foley catheter. So I thought this was a perfect opportunity to teach her how to insert a Foley catheter. So we were in the patient's room, and unfortunately, she wasn't able to get it the first try. So it took longer than what was expected. So we had to go and get another kit. And then when we came back, the nurse, she was sitting outside of the room, and she came in. She was a little bit frustrated because she was like, why is it taking so long? So I just explained to her, I'm trying to teach her, how to maintain sterile procedure. And, I just want her to do this the right way, especially because she's going to be doing this once she's off of orientation. So we got the second kit, and she was able to successfully put in the Foley catheter, and the nurse was understanding. I just had to explain that to her. So yeah.
Okay. Can you please tell us about a time when you had to be creative or innovative at work?
Ooh, creative or innovative at work.
So people
Um,
usually talk about like a time there was like a new kind of equipment or like some kind of creative solution they had to kind of make up on the fly for like tailored care for a patient.
okay. So I had a patient who was being discharged to a rehab facility, and me and the nurse were trying to get the patient ready, and because transport was already there, but we realized that the patient was incontinent, and she was too big to fit the diaper. So I suggested to the nurse if we could use the chuck pad as a diaper and put that over her so that, she wouldn't, so that she'd be able to, get to her rehab facility without having to worry about, having a little leakage. So we were able to do that. And the patient was so impressed. She was like, this is so smart. So yeah, it was great. I was going to ask her, I was going to keep it to what tools could I use, or what is some advice that you would give for a new grad like me to be successful on your floor? That was one question that I had.
Okay.
Another question I had was, what are some challenges that you've seen with new graduate nurses on your floor? And then another question I have, I don't know if this is too general, but I was going to ask, like, what are some successes on your unit that you're really proud of?
Managers like love to talk about like their goals, like
Mm.
we're kind of like focused on the ground level of like what's going on with our specific patients, but they usually get pressure from like their management to reduce infections and reduce falls and stuff. You can ask them um, in terms of maybe like falls or reducing infections, like what are the current goals on the unit. I'd love to hear what you guys are
Okay.
working on. And then they might go
Mm-hmm.
off, like they might start talking about all these things. And then if they do that, you can like in your thank you letter, and by the way, you don't have to like handwrite some like formal thing, you can just email them afterwards. And
Mm-hmm.
I feel like the tendency is for people to say like, thanks for meeting with me again, here are all the reasons why I'm awesome,
Mm-hmm.
thanks, look forward to hearing from you. But I feel like you connect with them way better if you talk about the stuff that you guys talked about in the interview, like thank you so much for sharing this such and such thing that you're working on,
Mm-hmm.
and explain why you think that's great and you look forward to the possibility of learning from them and working with someone so amazing or whatever, so
Okay.
like your thank you letter is about them,
Mm.
you know
Yeah. Yeah.
um
I just think a question that will spark their interest too, because I feel like that's something that they're passionate about. So I feel like,
yeah,
just getting to feel their personality will be, I think that's a good
yeah.
idea.
So especially because you're pretty fast, if you have a bunch of time at the end, that'll
Mm.
help. Because otherwise it's like, they're all kind of like, well, if nobody has any more questions, you know,
Right.
yeah,
Mm-hmm.
it gets a little
Okay.
awkward. Yeah.
It does.
Um,
Yeah.
can you please tell me about a time when you had to give constructive feedback to a coworker?
Mm. So I was precepting this nursing student who was coming on to be a PCT on her, and I was with her for the whole week, so for 3 days since I'm full time. And I just felt like she wasn't really using the tools that I was giving her. She wasn't really being an active participant, by taking notes and asking me questions. So the first thing I did was I confronted her and I asked, do you have any feedback for me? Is there anything that you feel like I could do better as a preceptor? And then once I heard her feedback, I was honest with her, and I told her I'm coming from someone who's a concerned employee, and I mean a concerned like colleague, and I want you to be successful on this floor. And just know that like training and being on your own as a tech is going to be very different. So, make sure you're asking me all the questions that you have now in your training, because you won't have this opportunity once you're on the floor. So she really appreciated that honesty. And even after she got off of training, she continued to ask me questions, and we built our relationship, and I was like a mentor to her.
You're so good at this. It's kind of scary.
Huh?
It's like, you're so good at this. I'm like, you should maybe start coaching people too. Can you please tell me about a time when you were on a team that was not functioning correctly?
I don't know if I have like a work situation, but I do have like I was in an a cappella group in college, and I was on board for 4 years, and my last year I was president. So it was something that I was heavily involved in, and I loved it. I love to sing. It's been a hobby of mine like as long as I could remember. But I remember when I was when I was a sophomore, we had a lot of older members leave, and we took in a lot of new members. So in the beginning it was a little bit awkward, especially with the different voices and the different personalities. We really had to learn how to work as this new group, especially because the year before that our group was solid. Besides me, there was only one other new member. So it wasn't like they were adding in, a lot of new members. But with this, our group was totally changed. So as the year went on and as the board gained more confidence, we kind of had a better direction of what the group should look like. We were able to better work as a team and realize that at the end of the day, like even if there's drama or people are upset, we're here to sing together. That's the point of us being in this group. So I don't know if that's all right. I just kind of came up with that example.
It's got potential. So what you've got to
Okay.
do is you've got to bridge it to something that's useful in nursing. So like I would avoid using the word like drama. I'd avoid, because it kind of sounds like, it kind of sounded like you're like, it doesn't matter if we don't like each other. We're here to do a job. Which I think sounds a little, I don't know. I feel like instead of that part, you could say, like, what do we want to say that it taught you that you use in nursing? Like you learned what a difference it can make, like when you really establish a flow of like what clear expectations are so that everyone can do their part, which makes everything flow. Like I'm just thinking like a code blue, right? You have like your RT knows like their job is to help with the bagging, and then like the recorder knows like it's their job is to stand there and like record everything that's happening. You know what I mean? Like I'm kind of trying to picture bridging you to that kind of thing.
Yeah.
You can totally use like the acapella thing is it's cool because it's different. We just have to like make it like relevant to something that makes you a better nurse.
Yeah, I just remember this other situation that I had at work. So I had a situation where, since as a tech in the ICU, one of my roles was to also be a part of the hospital code team. So anytime that there was a code, no matter what floor it was on, I had to go and do compressions. So we had
why have we not talked about this yet? Oh my god.
Yeah, I wasn't sure where I should like put this in because I have like other examples, but I remember we had a code on a med surg floor that I went to, and it was kind of a mess. Like the leads weren't on right. The primary nurse for the patient wasn't in the room. It was just really disorganized, and there were a lot of people in the room that probably shouldn't have been. And when people would ask for supplies outside, like to the runner, there wasn't really a runner. No one was really going in and out of the room to get the supplies, which was really frustrating. Like at one point, while I was waiting for my next, there was like 3 of us switching off to do compression. So right after I was done, I went out to grab the suction tubing because they were asking for that for a while and I was getting frustrated. So I went in, grabbed that, and then came back into the room. But we like debriefed after. Our nursing educator just kind of talked about it, like talked about what we could have done better, talking about, she brought up like how to lead in the right place. And I realized like in order for, every little thing, even if, well, not little, but like every part of a code is super important and, can really make or break your patient. And, it's really important to have that teamwork and to have that flow of communication, no matter what floor you're on, even if you're not used to, having codes on your floor. I think that's really important for every unit to have that flow of communication, being able to handle, a crisis situation like this.
Yeah. What other stories do you have related to you being on this? Because I didn't even think, did I see this on your resume? I didn't understand that you had this opportunity.
I think under the ICU, I think it was like the first bullet I said that I was like facilitated codes. But I guess I probably should have said that I was actually a part of the code team, since I was there, like actually doing compressions every time there was a code.
Yeah, that's super cool. So what other stories can you tell that would let you like brag about that? Because like just exposure to codes is huge.
Let me see. Yeah. Like successful codes that we've had. There was another code that I went to on, where was it? There was a lot, actually. There was a lot of codes. So I'm just trying to think which one was the most.
Because I really doubt like the people that you're up against will have that, right?
Oh, so we had a situation one shift, and it's like nurses, like even months after they talked about this one shift, because it was crazy. We had 4 codes in the hospital that day, and 2 of them happened at like the same time. So it was probably like one of the busiest shifts I'd ever had. Like I remember we were doing compressions on one patient, and then another patient on the opposite side of the hallway also was coding. So it was a lot, just trying to figure out, which rooms I had to go to, making sure that all of the patients were getting, proper compressions, that there were people in the room doing CPR for them, that every patient was, all the different code teams were fully staffed. And because we had to transfer all those patients to our ICU, I had to run back and forth from the med-surg unit to our ICU to just grab the monitors, grab the A line, because they had to put in an A line for one of the patients. Trying to see. Sorry, I remember the story because there was a lot, and this was a little bit ago.
Can you tell me about like one specific code where like there was something that you did that kind of like helped make sure that patient made it? Even if it was like you went to grab something or you recognized something that like a gap that needed to be filled in like the flow of things, or like
gap that need to be filled.
Like noticing that, what were you saying? There was something that was bugging you, like no suction tubing?
Yeah,
I kind of want to picture like like what was wrong with the patient and how like you doing that thing like changed the trajectory. Like, can you like something like that?
I think this patient, I can't remember what brought him into the hospital, because he was, but I think the reason why he coded was because he had choked. So that's why it was really important that we had the suction in the room.
And then that's like, why did this guy make it?
Huh?
Did I make it?
So he made it. It was a long code though. Like we were in the room for maybe like 40 minutes. It was a while. But I just remember that shift, like our nursing educator, when I was doing compressions, like she like was giving everyone feedback, and she told me like, good compressions, good job. And I just felt really proud, and just knowing that I was able to help this patient, and also just kind of be able to help the med-surg floor staff, because I feel like they aren't as used to codes happening on their floor. So they were a little bit like, I don't know, they didn't really know how to handle the situation. So I kind of had to take on that role of being a runner and going out to grab supplies while also performing PR. I don't know if that looks bad that I'm like, juggling both, but
I'm just trying to think like what question would we pair this to? I'm just taking a look to see what it might be. Oh, maybe like what about like leadership? Like, so if they ask you like, can you please tell us about any leadership, you could talk about being like the person who goes to help out with codes, and how like because you're like have experience on the floor as a tech, sort of where supplies are, and there was a patient that had a code, an aspiration code, and like tell the story about how you were able to get the suction like when there was no one
right. No, that's actually a really good point, because I knew what their supply room looked like, so I was able to just go and grab it. So yeah, that's a good point.
You could use it for that.
Okay.
Okay. Can you please tell us about a time when you provided compassionate care for a patient?
Okay. So I had a patient who came into our hospital because I came into her room in the morning to check her vitals, and I can just tell that she was really upset about something. So I tried to be an active listener, and she expressed her concerns to me and told me that she just didn't feel confident in herself because she wasn't doing as well as she wanted to with PT, and she wasn't sure if she was going to get better, and she was complaining about her hair because her hair was really matted at the time. So there wasn't really much I could do in that situation, but I knew that the one thing I could do was help her with her hair. So I told the patient, let me check on my other patients and make sure that I've got everything done for the morning, and then I'll come in and we can see what we can do about your hair. So I got the shampoo caps, like the ones that you like microwave for 30 seconds. And I had to have used maybe like 5 of them to just try to get all the knots out of her hair. Like it took a long time. I think I had to go through like 3 combs, and I was in there, I want to say, for maybe like 20-30 minutes just trying to help her out with her hair. But we got her hair in a nice braid, and the patient was like just super happy after. I could tell that she just felt better about herself, and I'm really grateful that I was able to empower her in that moment.
I love how much you like light up when you tell this story.
Oh, thank you.
I hope you get to share this one.
So I did have a patient who came in because the patient did not have any cardiac issues or a history of cardiac problems, but I heard in handoff report that the tele tech had read that she had Brady AFib. So as the morning went on, I noticed that I was wondering, what was going on with that patient in terms of like her dysrhythmia. It was cardiology going to go see her. So I was looking at the monitor, and I noticed that she also had an episode of a flutter. So I told the nurse, and I asked him to verify. I was like, is this a flutter that's showing on the monitor? And we found that the patient was actually having like episodes of Brady AFib and episodes of a flutter, like back and forth. So he checked the progress notes and saw that in the ED, she had an episode of AFib, and the note had said that cardiology was going to follow up with her, but no one had since she was admitted to the hospital. So the travel nurse that I was shadowing, he messaged the doctor to follow up about that, and the cardiologist got to go in and see the patient.
I like this because this is really the only story you've told me so far where it involves like you reading a rhythm strip. Okay. Maybe you could use this for like a time that you advocated for a patient.
Okay.
Or like a time you had to think critically, or like a time you had to escalate something, or like you could even relate it to like a question about communication, or like interdisciplinary team, because it's like you, the teletech, the doctor, the nurse. Yeah, I would work this in because like all your answers are good. I just think like what will set you apart from the other people is like sprinkle in like one sweet story, like the thing with the hair. I'd definitely say something about like being in the code team.
Mm-hmm.
use this one. And then there was one you talked about, like you were giving blood for somebody. What was that story?
Oh, the NG tube, and then there was like blood coming out of it. Yeah.
That was one where like it was kind of a turning point of like, oh, this girl knows what's up. Like we can trust her to not like derp out when things get real.
Mm.
Definitely tell that one.
Okay.
Yeah, you have a lot of great stories. I think it's just going to be a matter of like really making sure you don't leave the interview being like, oh, I didn't get to tell that one story, you know. Could you please tell us about what kind of environment you're looking for that will encourage your growth and challenge you?
Okay. So I want to be in an environment where I can be exposed to as much as I can, especially, being a new graduate nurse and coming out of nursing school with all this knowledge. I want to be able to continue to apply that and build my skill set. And I feel like that's what makes the ICU so perfect because you're working with the sickest of the sickest patients. So I want to be able to get my feet wet and all the possible equipment that heart nurses get to work with. I really have a passion for learning and for continually building my skills to become a better nurse. I also want to be in an environment that empowers their new graduates or novices like me so that we have the confidence to learn and grow.
Why are you interested in cardiac specifically?
So I'm interested in cardiac specifically just because I was really inspired by the nurses that I had the opportunity to work with when I transitioned from med surg to being in the ICU. Prior to being in the ICU, I didn't know what ICU nurses did, but once I moved over and I got to see how compassionate, how competent, I knew exactly the kind of nurse that I want to exemplify once I became one. And I think with cardiac, what makes it so interesting is that the heart affects every part, and, that you can learn from nurse. I think it's so cool with cardiac to be able to stabilize your patient post-operatively on a vent him the next day with PT, OT, getting to see your patients recover, I think is amazing.
This would be a really cool answer too for like, why do you want to be a nurse? Or the part that there's a part you said that I kind of wanted to steal for your about me. It was like your transition from med surg to ICU and what you saw and what it meant to you. See if you can like squeeze that in like in a really brief way to what you said, just that little sentence that you said right now in this. I'll give you the recording so you can listen to what you said. You can squeeze just that little bit into your about me or whatever you're like, tell us about yourself part, because you light up when you say that. And I feel like the earlier that you can like connect with them and have them see you like smile or like something, and like the earlier you can give them the impression of like, oh, she knows what's up in an emergency, like the sooner you'll get them on your side, and then they'll just kind of like roll with the yes, early on.
Okay. I feel like a lot better talking to you. Like this was so helpful. Thank you so much.
For sure. Let me know how these go. Okay.
I will. I'll keep you updated on everything.
Okay. All right. Thank you.
Bye.